Hello and welcome to our ADHD medication clinic. Well, this section really is for those that are interested in using ADHD medication to manage a diagnosis. In your first appointment, which is your titration appointment, we're going to be looking at your background, your history around medication. We're going to ask you to complete the normal forms. So step one, the consent to care treatment forms, if you haven't done so already with us. Step two, we're going to ask you to complete a really detailed, thorough medication history taking form. And that's because the prescribers need to be sure that it's safe for you to take either the stimuli or non-stimuli medication, depending on the pathways which you go down. If there are medical concerns or if there's a history of cardiac problems within the family, we may require additional checks to take place. They can be ECG monitoring for cardiac and heart, or again, further blood tests for liver function and kidney functions. We'll talk to you about those when we've got your medical history forms, whether or not they're going to be needed. At that first appointment, all of that information is going to take place, and then the clinician will discuss the different types of medication with you and what to expect from them and the different types of side effects. Throughout the first month, you'll have regular contact with your clinician, little check-ins, just making sure that everything's okay and those signs and symptoms are being better controlled. ADHD medication shouldn't change your personality. It shouldn't make you feel anything less than what you're kind of feeling. It's not going to make you a grade A student if you wasn't a grade A student before, but what it will do is it'll turn off the sound and the noise, hopefully, which is really distracting, slow your body down enough and slow your mind down enough so you're able to hear and process information in a much more timely and effective manner. Once you've gone through your titration process, we'll keep an eye on you and we'll regularly monitor you on a monthly basis. Each prescription requires an appointment to release that medication. So those appointments, again, are chargeable, but they're only half-an-hour appointments. In that appointment, we're going to be looking at your blood pressure, height, weight, and signs and symptoms of kind of the ADHD, whether they're improving, not improving, and side effects from that medication. So each month that's done. Once we've got you on a stable dose, once we're happy that everything's okay, if GPs are accepting shared care agreements, we'll be able to do a shared care agreement with you. Be mindful, though, that a lot of GPs are not doing shared care agreements at the moment, and nor are CAMs, so you can't take a private one and kind of get bumped up the list. So if you start this process on a private pathway, just make sure that you're able to carry that on in the future because you may not be able to get it through the NHS. So it's something that you do need to consider. Anyway, if you'd like further information, advice and guidance, please don't hesitate to contact us or talk to us about the next steps. And we look forward to seeing you in one of our clinics soon. Take care and bye for now.